We need to talk. We need to talk about your vagina. Your vagina has gotten out of shape. It's not your friend anymore. It's not helping you. And we need to talk about what's going on down there. As you know, I'm Dr. Christi Pramudji, and I'm a female pelvic medicine and reconstructive surgeon. I'm a urologist and a urogynecologist, and I'm here to teach you all about your female pelvic area, to empower you and educate you so that you can live a more full and a more comfortable and a better quality of life. So let's dive in. What am I talking about? I'm talking about vaginal atrophy, or the new fancy name, the genitourinary syndrome of menopause. What does that mean? Well, let's talk about the symptoms. So this is a very common condition, especially after menopause, but not always after menopause, and we'll talk about that, where the vaginal area becomes very uncomfortable. There is a lot of pain with intercourse, a lot of discomfort just sitting still, dryness, burning when you urinate, frequency to urinate, urgency, tearing and bleeding with intercourse, sometimes difficulty just sitting because your vagina is so uncomfortable. This is something that I see every day, and it can be quite distressing to patients. It is caused by primarily a lack of estrogen. So estrogen is essential for a healthy vaginal wall and a healthy bladder as well. The urethra and the bladder, the base of the bladder, have estrogen receptors on them. So if they are not getting estrogen, then they will start to malfunction, feel uncomfortable, and not feel right. So this usually occurs after menopause, when the ovaries are no longer producing estrogen, and so the tissues become starved for estrogen. They thin out. There is less blood flow, less collagen, less elastin, thin tissues, very fragile tissues, and very uncomfortable. Other causes that can lead to the genitourinary syndrome of menopause are chemotherapy, radiation to the area, lack of sexual intercourse. Sexual intercourse brings blood flow to the area, so it helps keeps the area healthy. Cigarette smoking. Cigarette smoking causes microvascular disease, so there's not good blood flow to the area. Diabetes also causes microvascular disease, and again, not good blood flow to the area, so not healthy tissue. All of these causes can contribute. One that people don't think about very often is prolonged breastfeeding. With prolonged breastfeeding, the estrogen levels are suppressed, and some women that breastfeed for a year or more can begin to feel very uncomfortable in the vaginal area, and it can be quite distressing. It will reverse when you stop breastfeeding and go back to normal condition. So this issue is something that a lot of women do not come to the doctor about, but it's something that can really be treated. So I highly recommend that you do go to your doctor and seek care and ask them about this condition. You need to see either a urologist, a urogynecologist, or a gynecologist. They will do a pelvic examination, and we can usually diagnose it based on the pelvic examination by looking at the tissues, looking at the walls of the vagina. You also need to have a good pelvic examination because this could be another disease that's mimicking genitourinary syndrome of menopause. I have seen cancer in the vaginal and the urethral area that mimicked these symptoms. You need to be checked for a bladder infection. So it's very important to have a proper evaluation prior to undergoing any kind of treatment for this problem. You need to see a doctor who's going to do a good pelvic examination on you. After the pelvic examination, there's really not any further testing to be done besides, as I mentioned, the urinalysis, and then you can begin treatment. You can begin treatment right now at home by using a home lubrication, such as KY lubrication, that you can put in the vagina every couple of days, and it will stay in the vagina. It's actually called a vaginal moisturizer, And if you can even, rather than just putting it in, if you even can rub it into the walls like a lotion, it's going to be much more effective. Some people aren't comfortable doing that, but that can really help to improve your condition. And then of course with intercourse, I recommend a water-based lubricant such as Astroglide or Eros, E-R-O-S. Those are silicone-based and they're very slippery and they don't dry up quickly, so they're very useful for intercourse. Those are the main treatments. Some people also use natural lubricants such as coconut oil or olive oil. Those work very well also. So those are some home treatments and what you need to do about diagnosis. I will be going into another video where I'm going to talk about other treatments for this, but that should be a good start for you to understand what's going on and to get started on home treatment for this. Thank you so much for watching, and I hope you'll subscribe to my channel. Click the little bell so you'll be notified each time I drop a new video every week. And also comment below if you have any questions or comments. And if you like this video or you learned something, give it a thumbs up. And if you didn't, you can give me a thumbs down. So thanks for watching. Have a great day and God bless you.